Hi, my name's Jenny. I'm the gynae matron at St Richard's and Worthing Hospitals, and I'm really excited to be part of the Menopause Cafe. We're really excited to try and put menopause a little bit more on the map within the trust, but also to start trying to get the taboo subject of talking about different aspects of women's health taken away. So what we're going to do now is I've got a short presentation that I'll go through, and we hope that that will be a driver to allow some discussions to open up a dialogue about the menopause, to hopefully try and answer some of your questions and to give you some facts and to help support people who are going through the menopause, or to support people who have got friends and family going through the menopause, or colleagues. So welcome, and we hope that you enjoy the Menopause Cafe. So welcome to our menopause presentation. This is just a short presentation to give you a little bit of an insight into some of the signs and symptoms of the menopause, but also to give you a little bit more information about some of the treatments, both medical and holistic treatments that are available to help support people through the menopause. And that, I think, will give us a little bit of a driver to then have some more open discussions and talk about other things that are around and about to help people out through this process. So the menopause is something that, as I mentioned earlier, every woman will go through at some point in their lives, and we define it as the point after your last period, essentially. On average in the UK, the average age for the menopause is 51 years, and 80% of those women who've gone through the menopause will have symptoms, and 25% of those are very severe. But unfortunately, like many things in women's health, there's quite a taboo for people to talk about the menopause, and only about 20% of women actually seek help. And given the fact that up to 25% of those people having those severe symptoms, lots of people are sitting at home without getting any kind of support when they're going through something that is actually quite debilitating for their everyday lives. Symptoms in general last for about 4 years, but for some people they can go on for a lot longer. And there's actually an alarmingly high percentage of 1% of women going through an early menopause before people are 40 years old. And so we spend a great proportion of our life going through that postmenopausal stage. We spend a lot of time when we're younger talking about starting our periods, going through puberty, and going through that kind of period of our lives where we're having regular periods. But actually, we're spending a lot of our time not having periods once we get to that point. And it's important that we start opening up that dialogue and that discussion to try and help people feel more open to talk about what it feels like to be going through the menopause. And that's something that our NICE guidelines nationally are talking about, trying to make sure that we look at everybody as an individual and provide people with that individualised care when they're going through the menopause. This is just a nice little caption of some of the signs and symptoms of what it feels like to go through the menopause. And I think the 7 dwarfs here do give us quite a lovely picture of what it might be like. I won't go through what we've put underneath them, but it is just a slightly more uplifting way to look at the menopause. There are 3 kind of key phases of the menopause. You've got obviously your normal reproductive life, and then you start going through that kind of early phase into the perimenopause prior to your last period, before you then go on to that period of the full menopause, which takes you into that later phase. Some of the early signs and symptoms are also signs and symptoms of lots of other things. So sometimes people don't realise to begin with that some of the symptoms that they're experiencing are to do with the menopause. Needless to say, I think most people are aware of the fact that hot flushes and night sweats are very common features of the menopause, but there are other things that people don't necessarily associate initially with the menopause. So headaches, and urinary problems, dizziness and dry skin being things that people don't always associate with the menopause. But actually, if you can help to try and manage some of those things, it makes it a lot easier to deal with some of those other symptoms that people might be feeling. There's massive psychological effects that people can go through, and they can hit people a little bit like an oncoming bus, where you don't realise that something's about to happen, and then suddenly your mood changes and you're not quite sure why. And it's all to do with those hormones changing in your body and different things happening that mean that the norm that you might have felt previously is not quite there anymore. And for some people, those mood changes might be very, very minor and not have a noticeable impact, but for other people, they feel that that's a big thing in their lives. And then there's also some of the more intimate things that can have an impact from the menopause, and that, you know, vaginal dryness and loss of libido, that can have a really big impact on people's home lives. And it's important that people are able to feel supported and getting support to find ways around those, or to get support to move forward in their lives in a slightly new phase. Urinary symptoms are something that I just mentioned, are quite common, and people can find that they have a frequency of going to the toilet, or discomfort when they go to the toilet, or suddenly find themselves having more urinary infections than they used to have. And it's also a time in people's lives where something like urinary stress incontinence might become more obvious or might become more common. There's lots of things that we can do within the healthcare system to support with these things. And so if you do suffer from any of those things, whether or not you're going through the menopause, it's really important that you don't sit at home and try and manage those things yourself and let them have a really big impact on your life, because actually there are lots of things we can do to try and support people through very low intervention mechanisms, and they can have a really positive impact on people's everyday lives. There's also lots of things we can do to help with some of the vaginal symptoms that people experience, which can also have quite far-reaching impacts. And so it's really important that if you are experiencing any of these things, that you do reach out to your GP for help, and they can, if necessary, refer you in to a gynecology team who specialise in supporting people going through the menopause for additional help. Some of the other things that I think people often do associate with the menopause are things like the impact on your bones. People talk about osteoporosis when people get into the menopause, and it's true that as we go into the menopause and our hormones all work differently, and we've got less of different hormones in our bodies, that things like our bone density can decrease. If you've got a family history of that kind of thing, it's really important to talk to your GP about that, to make sure that they've got the right advice for you, that if they recommend any supplements, that you get those at the right time, but also that we have the right monitoring in place, and that diet, etc., is appropriate to help support you going through those things. We've also got a slight increase as we get later in life anyway for cardiovascular events, but the menopause also increases that. And so if you do have a family history, or if you do have any concerns, it's another thing to make sure you do speak to your GP about. There are certain things that we can do to help mitigate both of these risks and to help support and lower the chances of anything happening. There's not a particularly good route of there's not been lots of research into women going through the menopause, and kind of one of the most recent big surveys that was on a decent cohort of people was done in 2016, which is actually now obviously quite a long time ago, but a useful survey that Ipsos Mori did, which did find that 50% of women don't consult a doctor at all during the menopause, and 42% of those women felt that actually the symptoms they experienced were worse than they'd expected them to be. It's quite telling when 50% said that their home and sex lives were impacted, and actually that work also and socialising can become more difficult. And everybody, 66% of people, so 2/3 of people, wanted more information about the menopause. And it's not something that is really easy to find helpful, straightforward information on in the media and online. So it's something that we do want to try and work on. I think as women's health takes a bigger line in the media, as it has done over the last few years, we've got a lot more going on in the media about all sorts of different areas of women's health. I think the taboo of talking about these things is reducing, and that as a result is going to help us to put things like the menopause more on the talk about page, and to find more helpful and straightforward information to help support people going through it. So how do you know that you're in the menopause? Well, we mainly rely on the symptoms that people are experiencing and the timing of those symptoms. It's not always helpful to do blood tests to confirm that people are in the menopause, but sometimes it is the right thing to do, particularly if someone is potentially showing signs of going through the menopause earlier than you might anticipate. Usually if we do blood tests to try and confirm whether someone is or isn't in the menopause, we do a series of blood tests about 6 weeks apart, because it gives us a good reliable answer through looking at the hormones, and it allows us to see exactly what is going on with people's hormones. But primarily the way that we are able to say that somebody is going through the menopause is by looking at the timing of their symptoms, particularly. So as I mentioned earlier, about 10% of women experience the menopause before they're 45, and about 1% of women go through the menopause before they're 40. And that can be for a variety of reasons, most often due to what we call premature ovarian insufficiency, but also sometimes for medically induced reasons as a result of other medical conditions. There are lots of different ways that we can support the menopause. Lots of things that we can do at home without needing any medical interventions. Lifestyle, for instance, is a really useful thing to look at. Stopping and reducing smoking, having a healthy diet. Some people find that different things impact them that don't affect other people. For instance, some people find that a glass of wine exacerbates their symptoms, whilst others find that a glass of wine helps them to sleep. So it's very much something that you have to do by trial and error, and slowly introduce and take things out of your everyday life to see if they help to support your symptoms and make you feel brighter and better, or whether or not they have a negative impact. Some people find that things like yoga, other relaxation tools are really helpful. And then just simple things like wearing clothes that are cotton rather than synthetic can be really helpful at helping to reduce the impact of things like a hot flush. Medical treatments like hormone replacement therapy are very, very helpful and are completely the right therapy for lots of people. It's very important that you discuss that with your GP or with a specialist clinician in a hospital environment, and because there are lots of different types of HRT and different ones work well or are suitable for different people. There's also things like cognitive behavioural therapy, which can be helpful for people in certain circumstances. And if you are finding that from a psychological perspective, life is difficult at the point of your life that you're going through, it's really important that you reach out to the support networks that are around. For instance, in West Sussex, we're really lucky to have Time to Talk, which is able to provide mental health support to people who are able to self-refer, and that's a really valuable tool for people to make use of. In terms of those kinds of everyday things that can have a really big impact on our quality of life and our self-esteem, there's other things that we can do that GPs can refer you to, but also there's some self-help out there, things like vaginal lubricants, as you can see on the screen now. And if mood is something that is causing an impact on your everyday life, it's really important that you talk to your GP about the potential of seeing whether there's anything medical that we can do to support you at the moment to go through this period of your life. And like I mentioned earlier, it's really important that we look at us as a whole, and looking at things like what we can do to support bone density is really important. And so for some people, it's really valuable for the GP to prescribe things that will help manage bone density. And then there are some more kind of herbal and holistic therapies available, but it's really important that you do talk to your GP or a specialist about what you're taking, because there are interactions with medical and holistic interventions, herbal interventions that aren't always useful interactions. And so please do make sure that before you start taking anything in conjunction with any medication, that you make sure you discuss that with a medical practitioner. So HRT is something that often is in the media for various different reasons. It can be very, very, very helpful for people who are going through the menopause. It's really helpful to help support people going through hot flushes and night sweats, which creep up on people when they least want it or least expect it to, and can be really, really have a negative impact on people's lives. It can also give a kind of more consistent control on symptoms than some of the other therapies and alternatives that are out there, as well as supporting people through some of those mood changes, and also helping to reduce muscle and joint pains, and is good for bone density. It can also help some people with their libido, and can also have a really positive impact on vaginal and bladder symptoms as well. There are lots of different types of HRT, as I said. Different people are suited to different things depending on their lifestyles, and depending on what their symptoms are particularly. There's also other things that we need to take into account. For instance, whether or not someone has had a hysterectomy in the past will make an impact on what kind of HRT is suitable, and other parts of your medical history. And so it's really important that you do discuss them with a clinician. There are different things that we do as well, depending on the time that someone's going through the menopause, because we may need to combine HRT with other things to help support the hormonal balance within our bodies as well. So please do make sure that if you're considering HRT, that you talk to your GP or a specialist about it. Often people talk about people not being suitable for HRT, and that's something that there's always new and emerging information about. For a long time, anyone who'd had breast cancer was advised against taking HRT. That is now no longer always the recommendation, and it's really important that people talk to their specialists, but also talk to menopause specialists about what is right for them, because one size does not fit all. And it's really important that we look at the risks and benefits of everything rather than just HRT in isolation, because what's right for one person may actually not be the right thing for somebody else. So there are some contraindications to people taking HRT, but this is not an exhaustive list, and this is not necessarily a list that is exact. So please don't take this as a definite yes or no if it's something that you're considering. There's questions about safety and efficacy of things to do with HRT. I'm not going to go through all of these individually, but it's important that we consider everything when we do go through the process of looking at HRT, and what other alternatives there are that may be appropriate for somebody at the time as well. There's loads of different resources out there, but as I said, it's quite hard to sometimes come across clear and straightforward information. And so I would recommend that you do have a look around, but find stuff that works for you and gives you the kind of information in the right kind of format and the right kind of style for what you have an interest in finding out more about, or that deals with the menopause in a way that's right for you. Things like the DAISY network are really helpful, particularly for people who are going through the premature menopause. And then things like the NICE guidance is obviously a lot more clinical and kind of formal around the edges. But really important that you have a look around to see what is there and what is helpful for you. There's also podcasts available for people who've gone that people talk about going through the menopause. Women's Hour, for instance, has done a lot of special editions over the last 12 months on women's health, and particularly focusing on things like the menopause. So have a look around at all the different things that are available for you out there. But the biggest and most important thing is that you don't go through this process on your own, that you do reach out and get support. Women are all going through this at all different times in their lives, and it's something that once we open the conversation, I think that we can find that we can all support each other to go through. There are small and little interventions that we can do to make our lives easier, about desk placement in offices potentially, so that people who potentially do suffer from things like hot flushes are closer to the window in case they need to be, because it gives them a little bit more access to fresh air, or maybe working out different times of day to take a break if you know that potentially certain times of day are harder for you or harder for a colleague. So there's lots of small things we can do to make our lives easier, but also we can reach out to medical support, but also support from other tools out there to try and make our lives easier when we all go through this experience. So hopefully we can go from feeling like this to feeling like this by starting these discussions and by really putting our Menopause Cafe on the map here, but hopefully nationally getting menopause a little bit more on the agenda. Thanks.